Now we're in the esophagus. I'm going to give you the basics of the esophagus. Then we're going to go back and look at swallowing, which is getting the food down that esophagus, into and then down. So first, the anatomy of the esophagus. Well, this is it. So this tube here is the esophagus. Below that, there's the stomach. That's where we're trying to go. The role of the esophagus is just propulsion. We're trying to get food from the oral cavity into the stomach. That's the goal. This here is the trachea. And there's two other important components in this picture. We've got two sphincters. One is a name that makes sense, upper esophageal sphincter. A sphincter, remember, is a muscular valve that can open and close. And so when it contracts, it's going to close. When it relaxes, it opens, so we can control things going in and out. We have lots of sphincters in the digestive system. This sphincter down here is in between the esophagus and the stomach. It has a name that also makes sense. It's called the lower esophageal sphincter. Also can be called the cardiac sphincter. So these two sphincters are going to help us control food passage. We are going to have this muscular tube. Remember, we've already talked about how most of the alimentary canal is a muscular tube. We're going to have the upper 2/3 of the esophagus, and we'll look at the histology in just a moment, be both smooth and skeletal muscle. So there's going to be some kind of conscious control that's skeletal that's going to happen at a little bit, but then this lower 1/3 is just smooth muscle. There's also smooth muscle up here, so some of that swallowing is going to be involuntary. This smooth muscle is going to contract and relax and allow our esophagus to move food, the bolus, down it. This is called peristalsis, and we will look, we'll see this again, both in the intestine and in the esophagus. So peristalsis is movement in one direction, in this case from the mouth to the stomach. And this happens via contraction of that's mostly smooth, but contraction of the muscle in coordinated patterns that allow for movement in one direction. We will see another kind of movement in the small intestine that's not just in one direction. Typically, in the digestive system, typically we want to go one direction. This is our stratified squamous epithelium that is protective in terms of layers can come off, get burnt chemically or temperature, and they will just regenerate. This entire piece here with the lamina propria underneath, here is our lamina propria, which is areolar tissue. What is that entire region called with these two tissue types? This is our mucosa. It's not respiratory mucosa because we're not in the respiratory system, but it's mucosa. That means we're going to have a submucosa. Both the submucosa and the mucosa are going to produce mucus that allow your food to pass easily. In this case, actually, it's more submucosa, more than in our pseudostratified. And then these last two layers here, these are muscular layers, or muscularis. Swallowing is also called degglutination. So there are three phases. The first one is conscious. You consciously control to initiate swallowing. This is done by the tongue, pharynx. Later on, we're going to involve the larynx and esophagus in swallowing. So step one is our buccal phase. Buccal refers to mouth. This is voluntary, mostly contraction of the tongue. So swallow right now, do it. You can feel your tongue kind of push back, and it's pushing tongue, that food, that bolus back against the hard palate and forcing that food into the oropharynx. So we're going from the oral cavity to the oropharynx. This is step one, buccal phase. It's consciously controlled. You control when you're gonna swallow. The upper esophageal sphincter is closed. There's no reason to have it open, and we might be breathing a little bit, so we can breathe through the trachea. When the food hits the oropharynx, there are receptors there that detect it. So receptors in the oropharynx are going to tell the medulla to come back, to tell the soft palate and uvula to close off the nasal cavity. And this is a reflex initiated by the food being here in the oropharynx. This phase is called the pharyngeal phase. I bet you can guess why. We're in the pharynx. Presence of the food in the pharynx triggers the medulla to feed back and cause that soft palate and uvula to flip up. Actually, primarily vagus nerve modulated. So the nasopharynx is closed off. The larynx muscles also close off the trachea. So this is the epiglottis. So we're going to say larynx muscles cause epiglottis to cover trachea. We don't want food going that way. The muscles of the pharynx contract as a muscular tube. The muscles of pharynx are also going to push that food back. Push food through this esophageal sphincter into esophagus. So this pharyngeal phase ends as we pass through the, actually I'll draw it here because I don't have room there, and it's about right here, open sphincter. I'm going to erase that little blip there. Okay, last phase, so we're in the esophagus, and basically you're not going back now. This part's all involuntary. So these two here, this was, I was gonna write up here for now, involuntary. Once you start swallowing, it hopefully goes down the right tube, but you can't really stop it. You don't really want to stop it or have it come back, right? 3 is the esophageal phase. Food enters the esophagus. This initiates peristalsis. Peristalsis propels the food. It's a bolus at this point to the stomach. It's going to, so this is closed now. Again, our upper sphincter. This food is going to continue to go down to the lower esophageal sphincter, which is then going to open. Well, I'll show you this on the next slide. These are short reflexes. It calls the relaxation of these sphincters. So it doesn't require central nervous system control. It's fast, and it's just regulated by that local distension mechanoreceptors of the food passing through. I do have one quick video to show you of this, and then we will look at what happens in the stomach. So because this video is of this This top portion, let me orient you. These might look familiar. These are your vocal cords. This is the epiglottis here. So that's the trachea. We don't want food to go that way. The esophagus is on this side over here. So this person is going to swallow, and we're going to see it's going to be really fast. This is flapping over as the food comes down. 3 different times here. So the flapping is about to happen as that applesauce hits. Pretty cool. This is a great view right here of that's down in the trachea. Food is going this way down there. Now that we're in the esophagus, right? Peristalsis has occurred to get us down. That propulsion via alternate waves of contraction and relaxation of the smooth and some skeletal muscles down the esophagus. Food's moved along that tract. The sphincter that is, as this goes down, this is peristalsis, the sphincter is going to open. So here, the circular muscles contract. That triggers a short reflex that is going to cause the lower esophageal sphincter to open. This allows food to enter the stomach. Food enters the stomach, sphincter closes, preventing regurgitation. Turns out that sphincter is actually a little bit weak. The diaphragm helps to hold down that food as well. Pretty cool. In the stomach, we're going to have mechanical breakdown and churning that we'll get to next.